I wish to discuss the issue affecting women with epilepsy on the eve of Epilepsy Week. Now, why it is important? Around 50% of the patients who attend epilepsy clinic are women. Worldwide, there are 30 million women with epilepsy. In India, 10 out of the 1000 pregnancies occur in women with active epilepsy. Being a woman with epilepsy is not the same as being a man with epilepsy, because epilepsy affects sexual development, menstrual cycle, aspects of contraception, fertility and reproduction. Now, what is epilepsy? Epilepsy is considered as a disease of the brain. A person who had at least 2 unprovoked seizures occurring 24 hours apart is labeled as epileptic or suffering from epilepsy. It is essential to know the issues affecting women with epilepsy, starting from puberty to adolescent age group, childbearing, that is 20 to 35 years, and to elderly women. Hormonal changes occur in the life of the women at various stages. Epilepsy and use of anti-epileptic drugs to control epilepsy alter the menstrual cycle and phases of women's life. The majority of women with epilepsy can marry and lead a normal life, and they can conceive. Non-hormonal method of contraception is the preferred in women with epilepsy, as anti-epileptic drugs alter the hormonal method of contraceptions. Pre-conception counseling should be given to all women with epilepsy planning for pregnancy. A seizure-free period of 9 months prior to conceiving is advisable. This reduces the risk of seizures during a pregnancy. Most pregnancies are uneventful and most babies are delivered healthy with no increased risk of obstetric complications in women. All women on anti-epileptic drugs should be on vitamin supplements such as vitamin B12, folate and vitamin K. Since the anti-epileptic drugs cause osteoporosis in women, hence calcium supplements should be given especially in the elderly age and childbearing age to prevent the risk of fracture, osteoporosis and osteomalacia. All women in epilepsy can breastfeed their babies. The amount of anti-epileptic drug transferred to the infant via breast milk is usually very small. During menopause, about 40% of the women report worsening of their seizure disorder. 27% improve and remaining there is no change. The most common cause is the usage of hormone replacement therapy in the menopausal age group. It occurs more in those ladies who have catamenial epilepsy. Now coming to the end, what is the take-home message? Take-home message in women with epilepsy is the regular anti-epileptic drug, regular consultation with the neurologist and gynecologist before planning pregnancy, vitamin B12, folate and calcium supplements in all women with epilepsy, and avoid seizure-provoking factors such as fasting, sleep deprivation and alcohol usage. Thank you for your patience.